Hello there, it's Dr. Mary Barbera here, and I am the author of the new book, Turn Autism Around, an action guide for parents of young children with early signs of autism. I am coming to you live every day in March, so this is day 6. I'm not even taking the weekends off. Today is all about planning, goal selection, and getting materials you're going to need to implement a new way to help kids with autism or signs of autism. So if you are here, I would love it if you would just leave me a comment so I know that you can see and hear me. Okay, and then I am also going to, okay, so planning, sorry about this. So I will get that going. If you are on YouTube with me now live, if you can let me know that in the comments, I'm going to just get us going on Facebook as well. Day 6. All right. All right. Always something technically going on, right? Okay, so I am Dr. Mary Barbera, and I am here to complete my live for today. I decided that in the month of March, and in anticipation of my brand new book coming out to the market March 30th, I am going to go live every day. So I have gone live now. This is my 6th day. Each day I kind of do a new topic and build on that. I'll also answer some questions. This is not just about kids with autism. It's also for young children with any kind of delays. For those of you that don't know me, I've been in the autism world for over 2 decades. First as a parent of a child with autism, and then as a professional board certified behavior analyst. I maintain my license as a registered nurse. I have a PhD. I wrote 2 best-selling books now. One of them is called The Verbal Behavior Approach, How to Teach Children with Autism and Related Disorders. It's available in over a dozen languages. And my brand new book, Turn Autism Around, an action guide for parents of young children with early signs of autism. So today I am going to talk about planning, goal selection, and what materials you need to start to implement the Turn Autism Around approach. While I said the book is not actually going to be shipped to your house until March 30th, you can pre-order the book and begin to read the book. Join our book launch team. All the details are at turnautismaround.com. Let me see if I can get that on the screen for those of you that are more visual. Okay, so turnautismaround.com for all the details. I'm going to jump in now and cover the content for today. I see we have Lily Daisy here from Australia, and she has jumped on each and every time I have gone live in the past 6 days. So special welcome to anybody who's a returner. I would like help finding a support group. Well, you can order the book and join us in our book launch team. So my idea is the more knowledge you have as a parent, the more support you will get. So my approach is very much like learn the 4 steps, which are assessment, which I covered a couple days ago, planning, which I'm going to talk about today, teaching, which I'm kind of weaving in a lot of teaching, and then data collection and evaluation, and what kind of easy data can you take to make sure things are working with or without professional help. Okay, so let me jump in. And if you have questions as I'm talking, let me know in the comments. I do have this little side camera here that I'm going to talk about planning and goal selection. So if you have a child who's been diagnosed with autism, and someone is paying for services, or even if you have early intervention services and your child is not diagnosed yet, if somebody is paying for services, whether that's your insurance company, your school district, a grant, early intervention services, if somebody is paying for services, there is always going to be an assessment and a plan with goals and some kind of data collection or quarterly progress or monthly progress or daily. Every time they come, they have to write daily progress towards the goal. So if you are about to dive into the Turn Autism Around book, and if you join the launch team now, you can start to read chapters 1 and 2, and chapter 3 will be available for the launch team next week. So you can begin to make progress right away. So if you do have a child receiving some kind of services, you're going to want to look at their goals. And what I find, and this is pretty much taken from chapter 5 of my book, I pretty much find that the goals are usually too high. In my son Lucas's case, Lucas is now 24. When he was 2, his goals were way too high. Some of them. Goals that he didn't get the skills for another 4 or 5 years. So that's what we have to be careful of. So let me show you. I think if I might need to turn this little guy off before I show you this. Okay. So I'm going to turn on my fancy little camera here and see if I can make this work. Okay, so part of the book and part of my approach and my online courses is the one-page assessment, which is explained in chapter 4. It's also explained in a short video when I went on live 2 days ago. Anyway, this is a one-page assessment form that you as a parent or a professional with a parent input can complete in about 10 minutes. And so once you complete this is completed for a little girl named Faith by her mother when she was 3 years of age. So she was diagnosed with autism at age 2. I know you can't probably read this, but I'm just going to give you the highlights. She is receiving early intervention services. She's not on a special diet, no allergies, no medication at this time. She does have safety awareness issues and unaware of traffic and water. Now we go down to self-care, feed self, weaned from a pacifier. She sleeps through the night in her own bed. She's not potty trained, but she just is 3 years and 0 months. So let's stop there, because you can see this is a whole thing here. Because today we really want to talk about not the assessment, but the plan that the assessment is built on. So the assessment, as I said, I went down the list. So her first area where we got anything that could be considered a strength or a need was that she was unsafe around traffic and water. And so here is a need, unsafe around traffic and water. And then we do go down the list, and she, even though she's 3, she can feed herself, which we will consider a strength. She sleeps through the night. We'll consider that a strength. And you see how we just bounce back and forth between the strengths and the needs based on the one-page assessment. The one-page assessment also goes into speaking, expressive language. This little girl could speak. She had about 15 words, 15 tacks. She could request some of her favorite items, but she wasn't echoic. If you said ball, she wouldn't say ball. She could not answer any questions, which are called intraverbal. So you just get the feel of this, right? I'm not going to go into every strength and need, but basically she didn't have the ability to echo. She was not potty trained. She could not sing songs or answer questions, poor social skills. And the last thing on this assessment form is flopping to the ground, whining and escaping 10 times a day or more. So that is a big, major problem, behaviors throughout the day, 10 times a day. So we take the strengths and the needs, and we then, based on Faith's age and family values and where we're at, then we come up with a plan, which is basically to follow the teaching methods that are outlined in my book, Turn Autism Around. They're also outlined in my courses, and I've been working on creating a step-by-step format for really over 2 decades. So the culmination is my book, where I've clearly identified the 4 steps of the Turn Autism Around approach. And this 1-page assessment, 1-page plan are included in the book, explanations about them, free downloads at turnautismaround.com will be available when the book comes out. So we went over goals a little bit, make sure they are based on this 1-page assessment. Now, you might say, well, I already have reams and reams of assessments. I don't need to do yet another assessment. But I would urge you that in order to move forward with the Turn Autism Around approach, you should do a snapshot, 1-page assessment, 1-page plan, because that's the way you're going to tell if professionals are working on colors, yet your child can't request things they want, then it's likely too high, which is the case for a number of kids, not just for my own son, but Kelsey, who is our community manager, and she's in the book. She's a single mom of 2 kids on the spectrum, and her ABA providers were trying to teach colors, and he was unsafe, and he couldn't request his wants and needs. So I think doing the assessment and the plan will really help you realize what an appropriate goal should be for your child. And then the third area of the planning chapter is knowing what materials you will need to begin to gather for implementation of the Turn Autism Around approach. So I have a materials checklist that you can get at marybarbera.com/materials. And those are all links to materials you can get on Amazon. Now, if you're not from this country, and there are things that aren't available on that list, you can just search for something similar. And you don't want to start implementing without reading the book or taking my online courses, because if you do that, if you gather the materials and you're like, oh, I saw a little video on that, I'll pull out a shoebox, I'll see what I can do, it's probably going to backfire, because while it doesn't sound that complicated, it kind of is. So I would urge you to take these little nuggets, but don't start implementing them without really knowing what you're doing. Okay, so Lynn says, looking forward to this discussion, older parents of a 28-year-old. And I have a 24-year-old now who remains with moderate to severe autism. So, if you have an older child or an adult who is not conversational, who still has needs in terms of safety, talking, tantrums, sleep, eating, potty training, tolerance of things like ear checks or blood draws or mask wearing, all the strategies in this book will help, whether it's a young child without any delays or whether it's an older, even an adult with significant needs. These are all proven strategies based on my experience as a registered nurse, as a behavior analyst, as a mom, as an advocate for our kids. I want all kids to reach their fullest potential and be as safe, as happy, as independent as possible. And that's a moving target, as I said in the last couple of days. Okay, so we have somebody watching from the Philippines. If you have questions, I'm happy to answer a few, especially if they're related to what I'm just talking about, because I did make a commitment to kind of come on and come on live every day. And I want to kind of keep it short and sweet and actionable. And really the best action you can take if you didn't, and maybe you could type in the chat if you already ordered, but the best action you can take, in my opinion, is to go ahead, pre-order the book, join our launch team. You'll be invited to a workshop really immerse yourself, because this book is going to be a game changer. This person says, Jamis says, my daughter is 3.5 and walks on her tiptoes. We call that toe walking. That is addressed in chapter 2 a little bit. So sometimes that is more of like a physical therapy issue too. You can have that evaluated medically. So I would look at that. A lot of my clients did need just some short-term use of some inserts or things that go into shoes. Make sure you also, just a general guide is to make sure shoes fit, make sure kids are measured, and make sure they wear shoes, because walking on tiptoes when you're running around barefoot is much more common than when you have actually sturdy sneakers on. So I would do those couple of things. Okay. My daughter is autistic. Is your book for me? She knows colors, words, fruits, and lots of things. She just doesn't communicate needs. She's not conversational. Yes, it's for anyone that is not conversational or has problems with tantrums, eating, sleeping, potty training, desensitization to doctors, dentists, haircuts, those sorts of things. So yes, if your child is not conversational, even if your child is conversational and has problems with any of those areas, this book will be helpful. Okay. All right. Thanks for addressing this. This is the toe walking question. She gets PT, OT, and is in special education school. I'm going to order this book. Yeah, definitely join the book launch team. Order the book, and maybe check with the PT about if she has any recommendations about toe walking. And I know for Lucas, as his feet grew, and you go into stores these days and you just pick out a pair and you're like, I guess they're good. And he was in the wrong size shoes for a couple of years. And he actually started having problem behaviors related to foot pain. And then I got him checked. And now it's like there are sneaker places around here, around my area, that actually you step on. It's almost like getting x-rays of your feet. And they're really advanced in terms of technology for measuring, but I would avoid just going into Target and picking out shoes, because like in Lucas's case, I had him in a 10 regular shoe and he was a 9 extra wide or something. It was bad. My 10-month-old rocks back and forth only when she hears music, but we'll do it for a prolonged time. Yeah. So that's not harmful, and even typically developing kids might rock sometimes. But what she's doing is basically keeping herself busy and entertained. I had a client who banged his head while he was rocking, and banged it so much, so frequently, on hard and soft surfaces, that he got an open lesion on his head. So doesn't sound like it's to that point, but what her behavior is telling you is she needs a lot of engagement. So with the book and my online courses, we really teach parents, even as young as 10 months old, how to engage your child, and how to get increased talking and babbling and imitation and things, that pointing and response to name and those sorts of things, how to look at the early signs possible of autism. Okay. Assad said, thank you, doctor. I have already ordered your book. Can you please advise me how to teach my grandson to use the toilet? He's 6 years old. So if you search Mary Autism plus your topic that you're concerned about, like rocking back and forth or potty, you're going to find a lot of free resources. and I do have a potty guide. In my first book, I have a chapter on potty, but I would really wait for the chapter on potty in this book. My first book was written in 2006, published in 2007, so that was a long time ago. So, the basics are just, make it a point to potty train. Doesn't mean, especially with a 6-year-old, that you're like, okay, we're done with diapers, you're going in underwear, you're going to pee all over, and, you'll just learn. That seems to be the philosophy of some people. So we need to, urine and feces is not, is filled with germs. So we want to, protect furniture, protect dignity, and there are certain ways to do potty. One thing with a 6-year-old or a 3-year-old or a 10-year-old boy is make sure they sit for pee until they're fully bowel trained. That's one piece of advice. Okay, so Tanzina said, for the past few days, we are seeing our 11-year-old son banging his head against the wall. The trigger is from nothing. And there's, ethically, legally, I can't, even if you were in my online course and you posted a question like that, I can't advise you because I don't know anything about your son, an 11-year-old to be banging his head. If it's all of a sudden, like you're suggesting, then I would take him to the doctor, because it could be tooth pain, ear pain, especially with behaviors that are all of a sudden. And you would need to learn how to step back, assess, plan, teach, work with professionals, work with your child's school. I mean, there's just so many factors, but realize that depending on how hard he's banging, like I've had kids where, banging and getting an open lesion. I've had kids bang so hard that they've gotten concussions. I've had kids try to bang their head into glass. So I've had kids, just do this, which doesn't seem that bad. But if a closed fist or if the child's really big and, just the magnitude of the force. So head banging is a self-injurious behavior that needs medical attention. But there is a chapter in my book on problem behavior reduction, and it's a big area that we talk about in my courses as well. Okay, and Jay Miss said she just pre-ordered the book, and it will be delivered March 30th. It will also be available on Kindle and on Audible. I read the book, so that's super exciting. I didn't get to read my first book. They just had some random person do it, I guess. And it's really exciting to be able to read the book. The book is full of stories, case studies, and actionable steps. I have a 20-year-old nonverbal daughter going to transition next year because once they turn 21, their school is no longer available, looking for an appropriate day program. And, a lot of the day programs, like Lucas was going to a day program in Pennsylvania, and with COVID, shut the doors. And they reopened a little bit, and now I hear they're closed again. It wasn't a great placement for him the last 6 months before COVID or a year before COVID, so we decided to try other things. But it is, it's a big issue for parents of all kids to have remote learning, to have day programs closed, to have schools closed. We're all struggling depending on where you live and what kind of services you have. Lily Daisy said, I'm so glad I've waited. Baby steps with Luke, too, with table time, slowly transitioning from high chair to table and chair for meals and snacks. Good. Okay. Sanella said, I pre-ordered your book, so can't wait to read it soon. Excellent. Make sure if you pre-order the book, you go to turnautismaround.com, put in your customer number, join us on the Facebook group because you can start to read it right now and be a part of our really strong group of over 500 like-minded parents and professionals and grandparents who are really going to get the message out. Why is tiptoe walking a concern? It's just not typical. And when children learn to walk, it might be okay for a little bit. But as they start to pick up the pace, go up steps, run, it just becomes clear that there's something going on. It can be a sign of autism. It can be a sign of something else. It might need medical treatment by a physician and or a physical therapist. Or a behaviorist too, but I have found that it really is usually more medical than behavioral. Besides just keeping shoes on, that sort of thing. My son is 2, has been diagnosed, only says a few words. And anybody that's saying a few words, I can teach you proven methods to get them talking more. My son had a few what I call pop-out words when he was little, but I had no idea back then what to do and how to teach him, but now I do. And here's the book I needed 2 decades ago. It's all outlined in there. Okay. All right. Well, I'm not going to get to every single question because I do need to run, but I hope you enjoyed this brief Facebook Live on the importance of making sure your goals are appropriate based on your assessment and your one-page plan. And also you can order materials that I'm going to be talking about in later lessons and the book. You can get a hop on getting the materials now. It's only a few weeks before the book comes out. So that is at marybarbera.com/materials. And I'll see you back here tomorrow for another Facebook and YouTube Live. Have a great one.